Welcome to Minister Anne Ravitt here today. Look forward to working with you in your new portfolio, and great to see a woman from the West. I think you'll know very much about the commencement matter that I'm going to raise today. It relates to Portiuncula University Hospital in Ballinasloe, an investment under the HSE capital plan for 2021 and also the winter plan for HSE for 2020. Minister, as you know very well, Portiuncula Hospital is a level 3 24/7 hospital. It works 365 days a year. It never stops. It handles casualty, it handles maternity, surgeries, and it's part of the Sailton network. It's one of those 7 hospitals as part of the network in the West, and we so need our hospitals in the West to be the hospitals fit for the 21st century. I suppose the thing that surprised me, really, when I was, involved last year in fighting for the 50-bed unit, was that it handles a catchment area of over 400,000 people. I mean, it's amazing. It's 5 counties, from East Galway, Roscommon, parts of Westmeath, Offaly, North Tip, and you'd know yourself from Portiuncula. I mean, even in Athlone, 21,000 people. If you live in Athlone, more than likely you were born in Portiuncula. So it is a hospital that has a huge catchment area. For people in Ballinasloe, it's an integral part of our identity, a vital service. Close to 800 people work in the hospital. We've excellent healthcare teams, even recently winning funding awards with Sláintecare. However, the hospital infrastructure dates back to the 1940s, a dire lack of shower and toilet facilities. And for an area of 400,000 people, Portiuncula Hospital has only 13 single rooms. And I'm not speaking about ICU beds, I'm talking about single rooms to keep people safe from infection. It's more so made up of 6 and 8 bed wards. In the face of this crisis with COVID, beds had to be closed and a special ward was designated for COVID within the hospital. And the general manager there and the teams have really taken the initiative. They've moved outpatients department out to a modular unit in the car park. They have funding for that modular unit. But funds are now required for the next step, to actually develop the outpatients unit into 13 single rooms en suite. So I really want to ask the Minister just to confirm that sufficient funds are listed in the HSE 2021 capital plan for the redesign and repurposing of the outpatients area in Portiuncula University Hospital as a matter of urgency. We need it now. Those 13 rooms, we need it now. We won't have them, even if it started in January, it'll be February before it's actually set up. I suppose as a councillor in 2019 with Minister Anne Ravitt, you were actually at the meeting I know we had here with the then Minister for Health, Simon Harris, and we had commitments to the actual 50-bed unit. Now, that was a 50-bed unit of single beds that was committed to, and the enabling works has started. I suppose the investment for that is crucial for the hospital to ensure adequate facilities, just single rooms to avoid basic overcrowding, infection, and make sure there's dignity for end of life for patients. As I mentioned, a hospital fit for the 21st century. Can I ask the Minister to confirm follow-on funding for stage 2 construction of this 50-bed single unit and the tender process to commence in January? So that's with HSE Estates, and we looked and we were given a date last year of a construction start date of July 2021. Very finally, Minister, the CT scanner is not currently fully operational in the hospital. You may be aware of this. It's due for equipment replacement in 2022. I suppose, could I ask the Minister here and within the Department of Health to consider whether a replacement CT scanner could be an urgent request for the 2021 equipment budget to allow for early diagnosis and to assist teams handling waiting lists? Minister, I really want to thank you for your time. I know out of all the ministers that are here, as a woman from the West, the importance of that hospital is crucial, and you will know yourself the lack of investment over the last few decades. This investment is crucial. I really look forward to hearing more from you now just about the commitment in terms of the great budget that we've achieved, extra $4 billion, and the commitment there to bed capacity as well. Thank you very much.
Can I now call on the Minister, and this is my first opportunity in the public session to congratulate you on your appointment as Minister, and equally to thank you for your work in the recent budget in securing $100 million for disabilities. Minister Anne Ravitt, you have 4 minutes.
Thank you, Chair. And thank you, Senator Dolan, for placing this question today. And before I go to the script, it gives me great pleasure to discuss Portiuncula, seeing as my youngest child was born in Portiuncula. It's 24 miles down the road from me, so I know it intimately well. A lot of my constituents work in Portiuncula, and it is an embedded fabric, not just in Ballinasloe, but in the wider spread as well. And it provides a huge service. I'm going to read the script, but then I'm going to focus on the 2 main questions that you have asked. And so I do thank you for raising the issue. Portiuncula Hospital Ballinasloe is one of our acute general and maternity hospital that delivers a patient-centred, quality-driven, focused service and provides a wide range of diagnostic and support services. The hospital catchment area, as you have said, includes from East Galway, Roscommon, the Midlands and the Midwest areas. The construction of the 50-bedded ward block is an important project for this hospital. A contractor was appointed for the enabling works, and works commenced on the 11th of August just gone 2020. The 50-bed ward block enabling work project is due for completion on the 25th of May 2021, and it is intended to advertise for contractors for construction of the 50-bed ward block in Q2 2020. So that should be about to progress as we're talking at the moment, Senator Dolan, with a view to commencing works on site in mid-2021, subject to availability of funding. Now, it is on the capital plan, and you did get commitments from the previous minister. I'm talking to the current minister on it, and it is a focus to keep it there and to ensure that there's funding following. As you know, this winter is expected to be particularly challenging due to the presence of COVID, and the government's determination to meet the challenge is demonstrated by its decision to invest the additional 600 in the health services this winter, 200 in 2020 and 400 million in 2021 to support the rollout of the winter-specific measures. For Portiuncula Hospital, it is proposed to provide the additional space that you addressed there with a prefab modular building for segregation, which will provide an immediate solution for emergency departments streaming from winter 2020 at the hospital. And the modular building proposed will facilitate for 14 temporary COVID-19 emergency department, minor injuries treatment, assessment rooms with associated support facilities. And the unit will also have a residual value for the displacement of outpatient accommodation after COVID-19 emergency. Now, what it says here, it is expected that the building will be ready for occupation by March 2021. I have a slight concern about it ready for occupation by March 2021 because that is at the end of our winter period. It's now at the moment that I know that the staff and the management of Portiuncula would like to have a commitment that they could actually start it, because we all know that the A&E in Portiuncula, it really is head to toe when it gets really busy inside in the A&E unit, and for with the COVID and with social distancing, they actually don't have that facility there at the moment, and hence the request that it needs to be prioritised, like other hospitals are getting around the country at the moment, and that is the nature of the question. I have spoken to Minister Donnelly about it, and I'm trying to get it prioritised. I know that our colleague also, Dennis Naughton, has also raised it. It's an issue of priority for the constituents in the area, for the simple reason being is the staff are at risk, the patients are at risk, and the demographics of the area. It's normally an older population that we have living in that particular area, and there's a fear of the GPs, from the GPs down, of referring people into Portiuncula with not having the adequate space or place for their patients.
Thank you, Minister. Senator, you have 1 minute.
Thank you very much, and thank you, Minister Abbott. It is great to hear that commitment, and I think just from what you've mentioned there, I mean, the commitments to Portiuncula University Hospital and the healthcare group mean that our healthcare teams in the West will be able to cope, right, when they're facing the worst public health crisis ever, and it means the patients in our hospital will receive the care that they deserve. I really would ask you, Minister, to accelerate that if at all possible. We need it now. The modular unit, as far as I know, is up and going. They got the funding for that. They've moved things out of the outpatients. If we could get a move on that in a quicker way, we would be able to have those beds available. That's single rooms to handle, I suppose, to handle isolation. You're dealing with infectious patients, be it with the potential COVID cases or just the normal flu. You're dealing with infectious cases, and we have no place to isolate them there. I very much appreciate your commitment to this, and all public representatives, as you'd be very aware, very much support Portiuncula Hospital, and I'm hoping at a national level the HSC will give that commitment as soon as possible to the sale of the healthcare group. I appreciate your time, Minister.
Thank you very much, Senator Dolan, on that. I didn't answer the question in relation to the CT scanner, and the HSE advised that the replacement of the CT scanner at Portiuncula is scheduled, as you say, 2021, 22 through the HSE equipment replacement programme. Priority for replacement is based on risk categorisation, covering age, dependability and service history, with capacity for replacement depending on availability of funding. So if there is an issue in anything anything I have said there that could actually support the management of Portiuncula if there's an issue there with risk categorisation. Maybe it's something that can be reviewed again. But be assured from the Department and from Minister Donnelly that we want to work with all public local elected representatives to ensure that the 50-bedded, the 14-bed modular unit, that the isolation rooms are made available and are there for the function of not just for isolation but protection of everybody that is coming in. So I look forward to working with you on it, Senator Dolan.
Thank you, Minister.